Hello, and welcome to my presentation for the 2025 International Congress for Qualitative Research and Theory Methodologies. My presentation is entitled, What Attracts Newly Licensed RNs to Adult Med-Surg Units in Southeastern Louisiana, USA. By the end of this presentation, you will be able to identify at least 4 recruitment attributes, appraise your unit's current practices against just culture, and develop a 90-day microplan for recruiting and onboarding new graduates to your facility. I'd like to show you a little bit about where the 2 universities I spoke about are. The first university is Northwestern State University, where I serve as a statistician and research methodologist. It's located in Natchitoches, Louisiana, which is approximately an hour and a half north of Baton Rouge, Louisiana. The second university is Grand Canyon University, which is located in Phoenix, Arizona, and it's also located in the USA. And I have both of these areas shown here for you. So the problem statement is, it is not known how newly licensed registered nurses describe the workplace attributes that influence their decision to accept positions on an adult medical surgical unit. The purpose statement then in this qualitative descriptive study was to explore how newly licensed registered nurses describe the attributes that influence their decision to accept employment on adult med-surgical units in acute care hospitals. I used the American Nurses Association Just Culture as a theoretical framework, and you may question, why would I choose this particular framework? But when nursing students are on a nursing unit, they observe everything. They observe how everyone acts. They observe how everyone treats each other. They observe how the manager treats their staff, how the physicians treat the nurses. And so when we consider a just culture, when we make an environment safe for everyone and the nursing students see that, then they're much more willing to want to work on their unit. So we have to ask ourselves, are we promoting a fair learning environment for everyone, including the nursing students? Sometimes what you see is the practicing nurses are mean to the nursing students. They talk down to them. They're not willing to help them. And when they do that, the nursing students are like, well, if they treat me like this now, how are they going to treat me if I come work here? So what they see is what they decide they're going to do in their future careers. And then they also watch how other nurses and managers differentiate behavior. Was it just a human mistake and they console and support them? Was it a behavior that caused some risk, possibly to the patient, where they may need additional coaching or education? Or finally, was it a reckless behavior, which required maybe remediation and discipline? And not every behavior is a reckless behavior. Some of them are just honest mistakes. And so how we choose to look at those behaviors influences how nursing students are going to view our nursing units. Do we foster psychological safety in a non-punitive way, where we look at the system problem versus the person problem? Do we ensure that staffing, training, and just responses are followed for patient safety, not just because someone spoke up? And then finally, do we foster an environment that fosters trust and strengthens onboarding and mentoring? Because remember, that's what the nursing students are looking at. So as we consider our individual environments on our units and why possibly we're having trouble recruiting new nurses, I want you to sort of remember what we talked about related to a just culture. So this study was with 10 new nurses that participated in the interviews. The study was reviewed by the Nursing Research Council at the major hospital where the study was conducted. There is also an IRB that approved the study. Each of the nurses, after they were recruited, signed an informed consent, and all of their names were blinded, both here and in the written documentation. And they did receive an honorarium for participating in the study, and a lunch card was also offered. So the setting was in 5 acute care hospitals here in southeastern Louisiana. Again, these were 10 newly licensed RNs who had been out of school less than 12 months and employed on an adult med-surg unit. They were a diverse group of people. There were 8 women and 2 men. 2 were African American and 1 was African American man. There was 1 Asian woman. There were 5 white women and 1 white man. And this diversity is pretty representative about to the numbers and types of nurses we have here in Southern Louisiana. And their ages were ranged from 23 to 59. Again, this was a qualitative method using a descriptive data analysis as outlined by Hauser. So you begin with the clinical question and analyze the data to inform your decisions and improve patient care. We aligned the methods to the design and the data, choosing techniques that fit the purpose and the evidence of the model. By systematic and being transparent, we defined the procedures, we maintained a code book, and we kept an official audit trail. To ensure rigor and credibility, dependability, and confirmability, we used peer debriefing and triangulation as appropriate between the 3 researchers. We upheld ethics, we protected confidentiality, we de-identified the records, and we represented the participants' words accurately. We fostered their words to translate into practice, to connect their findings to the actual recommendations, metrics, and next steps. So the data analysis procedure. The audio files were checked against the transcripts to confirm verbatim accuracy and authentic representation. The transcripts were transcribed by an external transcriptionist and confirmed by each of the research participants. The 3 researchers independently read each transcript and noted the salient words and sentences individually. We used open coding, which was applied to identify units of meaning, salient statements, and then we would group them into provisional categories. We used constant comparison within and across the interviews to examine fit and refined categories. The categories were then consolidated into patterns and emergent themes through team consensus and iterative review. We basically met in my office and we each talked about what we saw in each of the transcripts and why we had coded it the way we did and how we had grouped them and how we had come up with our own themes. And then we kind of compared like what each had, and then we all, with consensus, agreed to what the final themes were going to be. And all of our decisions were documented to strengthen the credibility and dependability of the project. So here's just a word cloud depicting the common words that were identified in the transcripts. And obviously, because it was about nurse and working, then those are going to be the primary words that are going to be depicted here. But you also see words like care, you see words like participant, you see words like recruit, you see words like support. And so some of those more predominant words that are more part of the research project are also viewed in this word cloud. So the first theme was get on the purple bus. And this would not resonate with individuals outside of southeastern Louisiana because the purple bus basically was coined by the CEO at one of the rural hospitals here in southeastern Louisiana. And the reason she coined it the purple bus was that she wanted to have a phrase that the nurses could use whenever they observed behaviors that was not conducive to what they believed at their facility. And so if you observe maybe someone talking about someone else or maybe not being helpful with your colleague, you might say something like, "You're not on the purple bus." Well, why a purple bus? Well, you have to understand that the main football team, and that's American football, not soccer, is located in Baton Rouge, Louisiana. And the LSU Tigers' main colors are purple and gold. And so that's where the purple bus came from because she was a staunch football advocate. She went to all the home games. She and her husband went to all the home games. And so it resonated not only with her, but also with the nurses here in southeastern Louisiana. And so, what did the theme "Get on the Purple Bus" mean? Well, it embodied the nurse being fully present, positive, and team oriented. So, like I said, if you're not, you're maybe speaking negatively about the unit or you're speaking negatively about like one of the nurses, someone might say to you, "Get on the purple bus." And it also, if they noticed you not helping your colleague, maybe the call light was going off and you're just sitting there charting and you're the only one in the nurse's station, someone might walk in the nurse's station and say, "Hey, you need to get on the purple bus." And the reason they chose a terminology like this is if there was anybody around, the only people that would know what the purple bus meant was the staff at the hospital. And also getting on the purple bus meant fostering excellence in patient care and supporting one another. So again, if they noticed that maybe, a nurse wasn't totally being supportive of the respiratory therapist or one of the other colleagues like the CNA in helping maybe turn a patient or get them off the bedpan or something like that, they may say, you need to get on the purple bus. So the sub themes of getting on the purple bus had to do with a just culture. And they wanted to create a culture within the hospitals that allowed nurses to be able to ask for help and encouraged learning without being punitive. I think all of us can remember our early days as a nurse and some of the mistakes we probably made or the things that we weren't really sure that we knew how to do. And we were afraid to go and ask someone else for fear that they would look at us funny or think less of us. And so we need to foster an environment where new nurses feel comfortable coming up to any faculty member or nurse or manager and asking for help. We also need to foster teamwork and proactive support for our peers. And, sometimes you'll see nurses throw new nurses, what I'll call under the bus, not under the purple bus, but just under the bus. In other words, they want to see them fail. I remember myself, there was a new nurse on the unit, and one of the nurses said to me, "You need to let her sink or swim because every time you go and help her, she's never going to learn how to do it herself." And my philosophy was never to let a nurse sink or swim. And that really bothered me. And when it came out in this research study, I said, wow, wouldn't that have been nice if we had had a culture back when I was a nurse on the floor that was how we all treated each other? And then, of course, we want to have a culture where it's more of a coaching environment, an educational environment, rather than a blaming environment. And most of our safety checks that we have within our hospital system here, they look for the process problem. They don't look for the people problem first. And so think about your own unit and when a nurse makes a mistake. Do you look at what the nurse did wrong, or do you look at the process that allowed the nurse to make the mistake? And so when you flip it to it being a process problem, people aren't so scared to bring forward that they made a mistake. And some of the voices that support this sub theme were people ask me and they help me. I always feel like they help me, like it's a sense of teamwork. Another nurse said, there's an opportunity to learn without feeling you're being reprimanded for it. And finally, knowing someone is there to help you, understanding that you're new and that you're still learning. The second sub theme of Get on the Purple Bus was to see me as a person. And, so many times in a lot of industries, not just nursing, as an employee, you just feel like an employee. You don't feel special. You don't feel like anyone sees you for the person that you are, or that you have a life like outside of your job or outside of work. And so when supervisors recognize that you do have a life outside of work, like maybe you're in school or you have a family or you have, parents who are ill that you have to take care of, and they recognize that and they support you for that, then that makes you want to work there. And then do you get flexible scheduling? Like what if your child is in a play at school and you want to attend their school play, but you're scheduled to work? Does your manager work with you to try to help you find another opportunity for you to be off that day and maybe work in someone else's place another day? And do the managers really even know you by name? Sometimes managers go out on a unit and they walk up to the nurse and they look at the name tag. Well, believe you me, the nursing students see that. The manager doesn't even know that nurse's name. Now, granted, there could be some agency staff there that are out from outside the hospital, but when a manager looks at her own staff and can't and doesn't recognize their name, then the nursing student be like, well, do I really want to work here? And then finally, is there support for personal circumstances? And does it foster loyalty and belonging? Like if you're sick, are you made to feel guilty because you're sick and you're calling in sick? I mean, I remember a time when I called in sick and basically I was told by the person on the other end of the phone, do you know that you're the second person on your unit that called out sick? And now the ones that are coming in are going to work short staff. Well, what was I supposed to do about that? I'm sorry that I was sick, and I'm sorry that one of my colleagues was sick. And maybe we both got sick at the same time because we had a patient on the unit who had some type of illness. So at the end of the day, we shouldn't make people feel guilty because they have personal circumstances that they can't really control. And some of the participant voices were when somebody meets you, they know you by name, and the second time when they see you, they call you by that name. And someone who works with you for your schedule and understands your life. And my manager pulled me in weekly just to ask me how things were going. The second theme was word on the street. And what does that mean? That means what is the reputation first of that hospital, not just that nursing unit, but that hospital. If that hospital has a very bad reputation, like there was a hospital here in southeastern Louisiana, and they used to call it Killer View. Well, how did it get that name? It got that name because the community reputation was such that if you went there, more than likely, either you went there to die because you were old and decrepit, or if you do go there for some other reason, you also would die, either from infection or some kind of medical error or something like that. So, what that hospital has as a reputation is first. And then, second, what that nursing unit has is a reputation because believe you me, nursing students talk and they'll be like, you don't want to be with that instructor because that instructor brings students to this nursing unit at this hospital. You need to try to get your clinicals with that instructor. So nursing units, even if it's a great hospital, nursing units can get really bad reputations too. And how the facility and the faculty and the current staff and peers treat nursing students has a heavy influence on whether they're going to choose that nursing unit or not. When you first walk onto the nursing unit, are you welcomed? Are you made to feel like the most important person on that nursing unit today? Because if you're not, when you go to work there and you're an employee with everybody else, then how are they going to make you feel? And so when they're trying to recruit you, they should have their best foot forward and they should be welcoming you with open arms. For instance, one of our facilities had what was called the red carpet treatment, so that when all of the students came on the nursing that morning, they had like coffee urns, they had donuts, they had special prizes for the nursing students that they could wear on their uniforms, like pins. And they really made the nursing students feel welcome. So you have to ask yourself, how is it that you welcome new nursing students to your nursing unit at the beginning of every semester? And then it was interesting to me when I did the study that the magnet status, or which is a premier status here in the USA of some of the better hospitals with better safety outcomes. And that's also measured by what we call HCAHPS. It's the Medicare guideline for safety practices here in hospitals. That the nursing students and the new nurses did not choose a hospital based on whether they had magnet status or whether they had center of excellence status or whether they had good quality outcomes. They chose the facility for how that facility made them feel. And so some of the participants' voices were, I got inside information, you start to hear things. You're going to like working there, or you're not going to like working there. And then they went on to say why. The nurses, weren't very nice to me at all. They acted like we were in the way. They were actually nicer to me though than they were to some of the girls. And so you do see that in nursing where there's this whole, like I'll call it pecking order, where they'll treat some like nursing students better than they treat others for whatever reason they've chosen that they like this one person over somebody else. And one of the first things I looked at was reputation. They were catty towards us, and their attitude was negative. And several people who worked there were upbeat and very positive about the place. And I heard positive things about the whole hospital and about the people and the nurses as a whole. Whether it was a magnet facility didn't cross my mind. I've always heard good things about this facility. People heard things, horror stories about this hospital. I would never consider applying there. They call it hell. And so, what you have to think about is what are the people on the street talking about your nursing unit? How do other people talk about your hospitals? Because believe you me, when a nursing student is making a decision to work on a nursing unit, that's how they make decisions. And so while there was some discussion about financial incentives, it wasn't sufficient enough to actually become a theme. They did talk about salaries and sign-on bonuses and tuition reimbursement, but they also basically said that that was true about most hospitals in our region. They also talked about a couple extra dollars wasn't going to like make them choose a facility, but more importantly, they were going to choose it based on whether they felt comfortable there, whether they felt it would be a good fit for them. And they also talked about here in the States, like if you take a sign-on bonus, you're locked in for like 1 or 2 years. And they spoke about they didn't want to take a sign-on bonus because they wanted to have flexibility and they wanted to be able to move to other places. And so basically what they told us was, I can't say my decision was financially based. The pay is pretty much the same anywhere you go. It's not, is it really worth a couple of extra dollars to not feel comfortable? I just don't want to be committed for 2 years. I didn't want to be tied down and signed to a contract. So how do these results advance nursing knowledge? First of all, how the manager is matters most. And other researchers have looked at this same phenomenon with transformational leadership and looking at retention. And this particular project was not about retention per se, but it was rather what attracted new nurses to come into that facility and that specific nursing unit. We also found similar findings to other researchers about a non-punitive learning and open communicative environment with the whole concept of the purple bus and how we need to show up with our presence and teamwork. The findings also supported the importance of workload and flexibility. And a lot of the younger nurses, they value having a flexible schedule and manageable workload much more than some of the older nurses. Like I remember when I first became a nurse, we worked days, 311, and nights, and we only had every third weekend off. And that's what every single nurse did. And so if you think about it, if you work nights last and then days, you got off on Saturday morning, right, at 7, and you had to be back at 7 a.m. Monday. So you weren't really off a whole weekend because most of Saturday you slept. So you really only had like a day and a half off. You really couldn't do anything, barely clean your house and go to the grocery store. So there wasn't any time for, anything fun. So these younger nurses, if they had to work a schedule like that, there would be no way that they would work at that facility. And I think the thing that really resonated with me a lot was that what we say is much more important than what you advertise. Because if you advertise something and they've either gone to that place or they go to that place, and what you've advertised doesn't match up, they're going to say that to other people. Like, well, they told me this was a great place to work and they told me all these reasons why, but when I got here, this is what I really found. And when you think about the amount of money that some hospitals offer, like $10,000 sign-on bonus to get nurses to stay like for a year, to come there and stay for like a year, to most nurses, they're not willing to jeopardize their happiness to go to a facility where they're not going to feel welcome. So I think we have to remember that a supportive manager who recognizes the new nurse's strengths and team fit is what matters most. While pay and benefits obviously are necessary in any job, that was not why the nurses chose those facilities. They listen more to word of mouth and firsthand clinical experiences and what their friends said about that facility or nursing unit than anything about paid advertising. And the message that they felt conveyed more importance to them were things like "you matter" or "we care," whereas terminology like "have fun" wasn't a message that was really interesting to them. And recruitment promises have to align with what either the nursing student or the new nurse sees on the nursing unit themselves. So as nurse managers, what can we do with this information? We can be authentic and have coaching oriented behaviors. We can round regularly, and not because we have to, because most hospitals, you have to round every day and you have to see at least two patients and you have to talk to at least two team members. Well, if you don't think that nurses are well aware of what you're doing and how fake that is not leading authentically. And so if they think you're just speaking to them or doing this because you have to, that's not going to go over well with them at all. To recruit and retain nurses, you have to have a strong team environment where staff members are there to help each other, that we pair new graduates with really trusted preceptors who want to precept. It's not see one, do one, teach one. And that's what happens a lot of times. You have a nurse who's been out for 3 to 6 months and they're precepting a new nurse. Well, they don't even know what they're doing yet. They don't even know the hospital policies, but they're teaching another nurse. And so we have to really think about who are our preceptors and how do we pair them up when they're, in on our nursing units. Do we offer flexible schedules with self-scheduling? Do we allow them to swap? Do we have creative shifts like maybe 4 10s? Do we allow messaging with what we actually say on our unit? Like, do we walk the talk or do we just walk the walk? Do we tailor our messaging to younger, newer nurses who want to, really emphasize work-life balance? How do we leverage multi-generational strengths and how do we match roles and talents? An older nurse may be more comfortable with nursing skills, whereas a younger nurse may be more comfortable with computer technology. And remember that managers are always on stage, and no matter what you do or say, somebody is watching you. And these are my references. And this is just how you can reach me if you would like more information. And I have both of my email addresses here. And you can also contact me through my cell phone by using WhatsApp. Thank you for attending. I hope you have a great day.